A yearly exam is a great opportunity to visit with your physician about ongoing medical issues and preventive care you may be eligible for. I'm COMCARE physician Dr. Garrett Hooker with Salina Regional Health Center.
Dr. Hooker, thank you so much for coming on the show. I want to take this time to talk about something that everybody should do, and that's see their physician once a year and talk about those yearly physicals.
Yeah, yearly physical is important because it gives us the opportunity to catch illness early. It's a lot easier to treat illnesses if they're caught early. Typically the treatment is a little easier maybe. So for example, you come in, check some lab work, your sugar's elevated. I might do some additional lab work and discover that you're pre-diabetic. So we make a few adjustments to your diet and exercise regimen and turn that around. Whereas if it had been a few years since you had seen me and we checked your lab and discovered that your A1C was really high, we might be talking about starting insulin. So another reason that yearly exams are important is it's an opportunity for us to discuss preventive medicine. So these would be things like screening exams such as colonoscopies, pap smears, mammograms. It's also an opportunity to discuss vaccinations you might be eligible for. A yearly exam is an important time for us to address chronic issues that have already been established, checking lab work, reassessing your response to medications that we have you on, talking about potential new treatments. And then it's also an opportunity to discuss any acute issues that may have arisen since you were last seen.
Well, I've had lots of physicians on the show, many of them talking about women's health. I've not really concentrated on a men's health show, so I wanted to kind of address that there. What are some things that you talk about specifically with the men that come see you?
Yeah, a couple things that come to mind that are kind of unique to men would be prostate cancer screening. So it's recommended to have a discussion with your physician about prostate cancer screening between the ages of 55 and 69. Over the age of 70, we generally don't screen, but again, there are some exceptions. And then the other unique issue to men would be to screen for an abdominal aortic aneurysm. So any man between the age of 65 and 75 who has ever smoked is at risk for developing an aneurysm of his abdominal aorta, which is kind of like a dilation. If you think of it like a balloon, eventually if the balloon gets big enough, it might pop. So you want to screen for that in men between the age of 65 and 75 who've ever smoked.
Well, thank you so much for some great information, and thank you for watching. For more information, visit SalinaRegionalComCare.com and like ComCare on Facebook.